Yes, sir.
Okay, okay. So can you see the slide? Can you see the slide?
Yes.
Yes,
Okay,
sir.
okay.
Yes,
So
sir.
last time we were discussing about the hemopoietic and the immune system, right? So let me continue and complete this system first. Then I will just jump to the next system of urinary system. Okay. So in the hemopoietic and the immune system, we have discussed about the very important anomaly about the autoimmune hemolytic anemia in falls. Then we have discussed about the classification of anemia, definition and classification of the anemia. Those are important so far your examination is also concerned, right? So, but on continuation of this, next topic is about polycythemia. Polycythemia means, poly means many. Okay, when there is increased number of RBCs, erythrocytes in the circulating blood, that is known as polycythemia. When there is decrease, that is anemia, right? Just opposite to that, polycythemia. And it can be relative increase as a result of when you have this dehydration, or when there is decrease in the plasma volume or absolute volume and due to anoxia. Okay, so in that case also you may have the increase of this erythrocyte in the circulating blood, and most commonly caused due to dehydration when there is diarrhea, vomition, or loss of body fluid, as in case of this edema or as in case of inflammation. Means if you have dehydration because of these conditions or disease conditions, then you may have this polycythemia. Then next is about the anoxia in high altitude. Last time we have discussed about brisket disease, high altitude disease, right? In that we have discussed about this oxygen and this less oxygen in the environment means anoxic condition in high altitude. So their polycythemia is one of the this results. Okay, then in some heart diseases like patent ductus arteriosus, as we have discussed earlier, then severe pulmonary emphysema, as well as erythroid leukemia. Okay, one kind of cancerous and which is blood cancer due to the transformation of these RBCs, erythrocytes, into blood cells. Okay, then in such cases, what kind of these changes you may come across in this case? So the animal will be having the problem of dehydration when the mucous membrane, visual mucous membrane will be dry as well as sticky. And there may be pulmonary emphysema and fibrosis of the lungs and increased hemoglobin concentration. Okay, just a minute. Karen. Then microscopically, if you see this polycythemic condition, automatically there will be increased number of RBCs in the slide, means as I am showing here. Okay, if you see under the microscope, you'll find that there are increased number of RBCs in the focus under the microscope, as well as this very severe damage of the lungs, where it means you may have congestion, emphysema, as well as fibrotic condition. Okay, so these are the microscopic changes you may come across in case of polycythemia. Then next topic is about leukocytosis. That means leuko means white blood cells. Okay, leukocyte is know that these are the white blood cells. When there is increased number of leukocytes in the circulating blood, then it is known as leukocytosis. When there is decreased leukocytopenia. Okay, this is about the increase. And this kind of this increase of these WBCs in the blood may be due to neoplasia, means in case of this blood cancer, like what we commonly known as leukemia. Okay, And according to the different leukocytes, so the increase of the cells, I mean these WBCs may be of different, I mean these cells like neutrophils, eosinophils, lymphocytes, basophils, as well as I mean your monocytes, right? So when there is increased number of neutrophils, then it is known as neutrophilia. Then when there is increased number of eosinophils, then it is known as eosinophilia. And when there is increase in the number of lymphocytic cells, lymphocytes, then it is known as lymphocytosis. And if it is of basophils, then basophilia. And when it is increase in the monocytes, then it is known as monocytosis. And this kind of this increase in the number of these WBCs or leukocytes may be caused by, in many of the bacterial infections, mostly means in bacterial infections, the most common cell, I mean this WBCs used to be increased is neutrophils, mostly of course in case of this pus forming organism infections, okay, pus this bioorganisms we used to call them. Then in case of viral infections as well as chronic bacterial infections, mostly there used to be increase in the lymphocytic cells, that means lymphocytosis. Whereas in case of parasitic infections or infestations, there has to be increased number of eosinophils, that means eosinophilia. Okay, so that may be sometimes as in case of this allergy also, I mean, okay, but mostly in case of this parasitic infections. And when we are talking about the allergic cases, allergies, means sometimes some cases of eosinophilia may be there, but mostly basophilia and the lymphocytosis used to be there. Okay, then if you see the changes, gross changes, let me just now, I mean, someone waiting for joining, I think. And if you see about the gross changes, there may not be any characteristic gross lesions. Like, I mean, sometimes, of course, there may be some reactive changes in the, I mean, this lymph node, which may show hyperplastic changes, or and there may be enlargement of the lymphoid organs like your spleen, thymus, and bursa of previous or bursa, as in case of, I mean, different species of Denman, particularly in case of this, you know, this avian species, bursa of previous is one of the most common lymphoid organ. Okay, so enlargement of all these lymphoid organs may be there. And when you see the, this section of these affected organs under the microscope after staining, then you may find increased number of total leukocytes. I mean, if you check first, the blood, the cell count, if you go for this total WBC count, so there will be too much increase in the number of this total WBC count, and as well as increased number maybe in the absolute lymphocytic cells, absolute neutrophils, absolute eosinophils, and hyperplastic lesions in those lymphoid organs like your spleen, thymus, as well as your, this bursa. Okay. Then these are some of the these few slides showing, this leukocytosis, the increased number of WBCs of different the cells like your this eosinophil, neutrophil, basophil, and monocytes like this. Okay. Then next topic is about leukopenia, just opposite to the earlier one. That means increased number of WBC known as leukocytosis. Then just opposite it is decreased number of leukocytes, then it is known as leukopenia. But I'm just giving some different terminologies like panleukopenia. Pan means 5. When the 5 different leukocytes like neutrophil, eosinophil, monocyte, lymphocytes, basophils, and all. So these 5 type of this leukocytes, when there is this decrease in all these 5 cells of these WBCs, then it is known as panleukopenia. When it is only in the neutrophils, means the decrease is only the neutrophils, then it is known as neutropenia. When it is only in the lymphocytic cells, then it is known as lymphopenia. Okay, then in such cases may be caused due to the congenital and this infections or diseases like this Higashi syndrome, and we have already discussed. Then infections like feline panleukopenia virus and infectious bursal disease virus is in case of this poultry or avian species. Then in case of chemicals like toxicity due to pesticides and heavy metals, as well as in case of these radiations like X-rays and gamma rays and all these things, right? So in all these cases, there has to be destruction of the WBCs leading to decreased number of these leukocytic cells. And if you go for gross changes to find the gross changes in case of leukopenia, then you will find atrophic condition of mostly all the lymphoid organs like your spleen, thymus, as well as your bursa of previous as in case of this poultry, right? And there may be recurrent infections, means this WBCs, the white blood cells, they are decreased in number. So that's why phagocytic, they are mostly these phagocytic cells, some of them. So they may not be able to this protect from the other infections. That's why recurrent infections or some other beneficial these bacterial infections can invade easily. And there may be vaccination failure because these are, mostly lymphocytic cells are the immune cells. Okay, when these immune cells are destructed and other phagocytic cells also so vaccination, this failure used to be there. Then there may be pyogenic disorders, means post-forming these organisms and leading to formation of these abscesses and all, right? So those are the, these diseases where this abscess formation is very common and mostly caused by pyogenic post-forming organisms. And there may be edema, hemorrhages in the bursa or previous. There may be atrophy of the organ bursa, mostly due to fibrosis, particularly as in case of this infectious bursal disease infection, that is mostly in case of this young poultry birds, right? Then microscopically, if you go for making section and this after staining, you see under the microscope and you'll find decrease in the total leukocyte count, as well as absolute neutrophil and this absolute leukocyte count also may be there. And there used to be degenerative and necrotic changes of the lymphoid cells in many of the follicles of the lymphoid organs. Means if you check and see under the microscope, mostly those lymphoid organs like spleen, thymus, as well as the bursa and all. So many of those follicles, which normally used to be filled up with lymphocytic cells, okay, intact lymphocytic cells, but those lymphocytic cells will show necrotic or depletion, means destruction or degenerative changes, as well as there may be edema, necrosis, as well as proliferation of fibrous connective tissue in case of bursa, that is bursa previous in infectious bursal disease. Okay. Then next is about spleenitis. That means the lymphoid organ spleen, if it is inflamed, that means the organ spleen is inflamed due to some reasons, like due to infections like bacteria, viral infections, maybe due to vitamins and minerals, or as in case of this amyloidosis, immunodeficiency, as in case of environmental pollutions, okay, like aflatoxin and all this thing, and the other different and this pollutants and all toxicity because of those things, right? And in such cases, the organ spleen may be this inflamed, that what we call spleenitis, right? And automatically, if it is inflamed, there will be enlargement of this organ, swollen and enlargement heavier than the normal, and this and the volume weight also, right? Then if you make the section, automatically, this congestion of the blood vessels inside this spleen, or there may be edema, proliferation of the lymphoid follicles as well as the lymphoid cells, and the organ may be atrophied, mostly as in case of this, this atrophic condition of the spleen may be due to proliferation of this fibrous connective tissue, and there may be even depletion or destruction of the lymphoid cells. That means the lymphocytic cells. Okay, so this kind of this spleen, which used to be inflamed due to many disease condition or infectious conditions and all these things. So this much enlargement of the organ or some necrotic patches, necrotic lesions on the surface of the spleen, or in chronic cases, or as sometimes in case of this immunological disorders also, this organ spleen may be inflamed, and there may be atrophic condition instead of enlargement, and that may be in case of this fibrosis. Other than that, of course, mostly enlargement will be there, except this this atrophy of the spleen due to fibrosis and the necrotic patches and the congestion. Of the blood vessels of this spleen. This leads to something like this mottling, this appearance of this spleen. Okay, so these are some of the this photographs showing splenitis. See the different this spleen of different species of these animals. Okay, and you can see this enlargement, even tumor-like growth, and this little bit this tumor-like necrotic lesions, and this mottling apparent due to the necrotic patches on the surface of this spleen, like this. Okay, little bit marbling appearance, also mottling. Okay, and the organ used to be much enlarged as compared to the normal one, like this. Okay, only thing is that it used to be reduced in size. That means atrophy will be there in case there is fibrosis, means fibrotic condition, proliferation of fibrous connective tissue, replacing almost all the parenchymal cells on this organ spleen. Then it will be atrophied, shrinkage, and which is reduction in the size, right? Then lymphadenitis, that is the inflammation of the lymph nodes. Adenitis, suffix this adenitis means glandular organ when they are inflamed, glandular this tissue or organ. Okay, so this lymph node, if they are inflamed, then it is known as lymphadenitis. So automatically there will be enlargement of this lymph node, except in case of this fibrosis, it may be atrophied, or this in case of this acute enlargement, so congestion may be there, or proliferation of lymphoid cell, depletion of the lymphoid cells may be there, edema also may be there, and the fibrosis of the lymph nodes leading to atrophy and this reduction in size in this case, and mostly caused by infectious agents like last time we have discussed about the disease rinderpest, morbidly virus causing this disease rinderpest there, and this lymphadenitis may be there. Then immunological disorder, as in case of this immunodeficiency, or as in case of this deficiency like deficiency of this protein. Then environmental pollutants like pesticides and heavy metals, or as in case of this cancerous growth like tumor, neoplasms, for example lymphosarcoma, one of the malignant tumor of the lymph node. Okay, so in such cases you may come across this condition of lymphadenitis, means inflammation of this lymph node. And if you check the gross changes, automatically means most cases will show enlargement of this lymph node, congestion and edema. Only in chronic cases when this proliferation of fibrous connective tissue, what we call fibrosis, used to be there, then only there will be atrophy of this lymph node. That means reduction in size due to shrinkage when this fibrous connective tissue replacing all the parenchymal cells, right? Then microscopically there may be congestion, edema, proliferation of the lymphoid cells, and in chronic cases proliferation of this fibrous connective tissue replacing all the parenchymal cells of this lymph node, as well as depletion of the fibrous this lymphoid cells, right? So these are some of the pictures showing here, and this one of the lymph gland neck, and this lymph node, this enlargement, and here measuring lymph node enlargement, showing this congestion, enlargement, edematous, and all, right? Then next topic is about thymoma or thymic hyperplasia. That means when there is congestion and hyperplastic condition of the lymphoid cells of this organ thymus, that means the inflammatory condition occurs of this organ, this thymus. Okay, that may be considered as our term as thymoma or thymic hyperplasia. Okay, so mostly in case of these chronic cases, So instead of enlargement, it may be atrophied, reduction in size due to proliferation of fibrous connective tissue, replacing the parenchymal cells, and mainly caused by immunological infections or disorders, disease conditions. Then environmental pollutants like pesticides, heavy metals, or as in case of these toxicities, toxins and poisoning cases. And in case of aging, means when the animal or people also, like when they are getting old. Okay, I mean in adult poultry, thymus used to regress. Okay, and if you go for this checking the gross lesions, then you may come across congestion, reddening of this organ thymus. There may be edematous swelling and increase in the size and atrophy only in case of this chronic cases when there is proliferation of fibrous connective tissue, right? And microscopically, you may come across this congestion, as I'm showing here, congestion or edematous, this edema condition, and proliferation of this fibers, and this proliferation of the lymphoid cells. Okay, many of these lymphocytic cells, and where, I mean, there used to be depletion also. I mean, this, in case of this normal and this thymus, it used to be filled up or mainly made up of lymphoid cells, normal intake lymphoid cells. Okay, and in case if it is inflamed or if it is this affected due to some infectious agents and all, right? So in that case, destruction or depletion of the lymphocytic cells means reduction in the number of these lymphocytic cells may be there. Okay, and in some cases there may be proliferation of this fibrous connective tissue, means fibrous connective tissue, fibroblasts replace the parenchymal cells, then means the lymphatic cells, right? So these are some cases where, I mean, this fibrous connective tissue means little bit in this area and replacing the normal lymphocytic cells. Okay, and lastly, bursitis, as in case of this poultry or avian species, one organ known as bursa or proboscis, okay, which used to lie there and present at the dorsal portion of, just on the dorsal surface of the rectum. Okay, means in the this practical class, I think, I hope I have shown this bursa. I mean, some this specimen of bursa of proboscis showing this enlargement, hemorrhagic lesions and all, as in case of the disease, particularly commonly known as infectious bursal disease. Okay, IBD in short. I don't know if we might learn it in poultry pathology, avian pathology or not. So in that case, this bursa of this proboscis, this lymphoid organ used to get inflamed. And mainly, if it is inflamed, there will be enlargement, there may be congestion, edema, or hemorrhagic lesions. Okay, or it may be, there may be reduction in size, what we call atrophy, when in chronic cases, when it is, I mean, showing fibrosis. Except this condition, others in such other cases, mostly it will get enlarged. Okay, and there will be depletion of the lymphocytic cells if this lymphoid organ, this bursa of the proboscis is, I mean, this cut into sections and stand it and see under the microscope. You will find this is also one of the very common, this lymphoid organ of the poultry species, and poultry and this or avian species, and mainly this made up of lymphoid cells or lymphocytic cells. Okay, so those normal intake lymphocytic cells used to be destructed or depleted, means there will be decrease in the number of these lymphocytic cells. And mainly this may be caused by one of the most common disease, as I have already mentioned, infectious bursal disease, IBD, caused by a virus known as virus. Okay, virus causes this disease, IBD. Then environmental pollutants due to pesticides and the heavy metals, toxicity and all these things, or sometimes in case of this aflatoxins also, like. Okay, then the affected organ, this bursa of proboscis, grossly, if you check it or see, then there will be enlargement of this organ. It may be congested or hemorrhagic lesions, and there may be edema, except in case of chronic cases when it may be atrophied or the reduction in the size due to fibrosis. Okay, so these are some of the, these pictures showing, this edematous condition, hemorrhagic lesions, severe hemorrhagic lesions, and enlargement as well as, okay, like this. the burst out prepuces used to get much enlarged, congested, and edematous and swollen and much enlarged. I mean this, okay, hemorrhagic lesions also may be there. And when you make section, I mean this is from outer surface. So like this, if you open it, this internal and this portion also may show the severe hemorrhage. Even clotting may be there. That much, I mean, this severe hemorrhage is used to be there. And if you make section, then you may come across edematous, this changes, depletion of the lymphocytic cells. These are the follicles of the burst out prepuces sheet. So many of the follicles, I mean, they are, I mean, the destructed lymphocytic cells are there. Means normally means it should be filled with intact lymphocytic cell, full of intact lymphocytic cells, normal. But in such cases, there has to be destruction or depletion of this lymphocytic cell. So there will be reduction in the cells, I mean, of this lymphocytes. Okay, and the degeneration as well as necrotic changes of this lymphocyte cells used to be there. And there may be congestion as well as hemorrhagic lesions, I mean, in the vessels. Okay, then proliferation of the fibrous connective tissue also may be there. Means sometimes in some cases, I mean, fibrous connective tissue may replace the normal intact, I mean, this lymphoid cells. And in such cases, of course, grossly, in case of, instead of enlargement, this organ used to get atrophied or decrease in size. Okay, so these are some more, I mean, pictures of the, I mean, this bursitis. Yes, in case of this, the main, I mean, this condition or disease condition, infectious bursal disease or IBD in short. And see these changes here in the dimple follicle. See, the last one, it is showing very typical destruction, depletion of the lymphocytic cells as well as this edematous and this hemorrhagic lesions. Right. So this way, this hemopoietic and the immune system is complete. So I will take up the pathology of urinary system. Okay. So on this next system about this pathology of this urinary system, here again we'll have some developmental anomalies. The first one is aplasia, means aplasia of some of the organs. Mostly now we are talking about, I mean, this kidney. When the kidney is not developed, not at all, I mean, there is absence. Okay, then we call it this aplasia, aplastic kidney. Okay, absence maybe one or both the kidneys. As you know, these are pair organs, these kidneys, right? So the absence may be only one, means right side or left side, or both. And absence of one kidney, suppose only one is absent. For example, right side, this kidney is absent, or left side is absent. So it may be observed, I mean, as in case of these animals, with compensatory hypertrophy of the another kidney, and such animals may survive. When means absence of both the kidneys are there, the animal will not survive for long. But only one kidney is absent, or like Ms. Ma'am heard about the kidney donors, means one kidney has been donated to someone or sold out. I mean, sometimes it happens, right? So in that case, the person or this animal also means in this case will not die. How? Means in such cases there has to be compensatory hypertrophy. I mean, last time in the disturbances, of growth in the general pathology, we have already discussed compensatory hypertrophy, right? Means in pair organs, when there is absence of one organ, one of these pair organ, left or right, then the other one which is present, that used to get enlarged, hypertrophied to compensate the loss of the other one. So that is known as compensatory hypertrophy. So in this case also, the other one will be this hypertrophied compensatorily. Okay, that is known as compensatory hypertrophy, and the animal can survive. Then next is hypoplasia. In this case, hypoplastic condition, decrease, occurs, hypoplasia, cells, number used to, and this decrease in it. So in this case, the size of the kidney used to remain small and which do not grow properly. It cannot grow up to the mature size. It remain this small size due to, some defects in the recessive or autosomal this gene, right? This autosomal, this gene. So it may be, so the kidney may remain small and cannot grow up to the mature level. Then there may be, this next is cyst in the kidney. Cyst, bladder like, this fluid field, cyst formation. As I have discussed, we have, seen some cyst lesions in the gross specimen also in the last practical class last time. And when there is formation of some cysts, maybe single or multiple cysts in the kidneys, most commonly as in case of this pig and dogs maybe, which may arise from the nephron due to its distension. When the nephron is much distended and containing more fluid, along with the urine. Okay, in that case, it may lead to a formation of one cyst-like or cyst, this like condition. Okay, or when there is presence of multiple cysts, means so many many number of these cysts are present. Okay, which can be termed as congenital polycystic kidney. Means if there is presence of multiple cysts, so that is termed as congenital polycystic kidney. So these are some of the this cystic kidney. See here, a very big size, and this single or solitary this cyst here in this kidney filled with fluid, or means along with that urine also may be there. And when we are talking about the compensatory hypertrophy of the kidney, the other one may be in the rudimentary size, or means it is completely absent. This is the normal size, for example. Then the other one, when there is absence of one of these kidneys, then the kidney which is present, okay, that will get hypertrophied due to the loss or due to the absence of the other one. When the normal size is this much only, for example, then it may get this much enlarged, hypertrophied, this much of this 4 or 5 times of its normal size, or more than that even. So this is known as compensatory hypertrophy of kidney when one is absent. So the other which is present used to get enlarged much, means get hypertrophied. That is known as compensatory hypertrophy of kidney. Then this polycystic kidney may be of different kinds. Type 1 polycystic kidney, type 2 polycystic kidney, type 3, this polycystic kidneys and all. So please go through it. This I will not just go in details. Just go on. I'm just having this, this different polycystic kidneys, type 1, type 2, type 3. Okay, now coming to functional disturbances of this urinary system. When the function, this normal function of the kidney, this excretion of the this urine from the kidney. Okay, then means what may be the disturbances when there is this kind many disturbances in the normal process of this urine excretion and this urinary system. So there may be proteinuria. That means presence of this protein, particularly the albumin in the urine. Okay, so it may remain as very smooth, homogeneous, pink staining precipitations, as we commonly known as cast in the urine sample. If you see under the microscope, also, right? And or sometimes in this beaker or your test tube and all these things in the form of this some precipitates in the form of cast, we used to say. And the presence of this albumin in the urine is to be indication of the damage in the glomeruli. That means when the glomeruli is having severe inflammatory reaction or this damage or this there, then automatically it means release of many this albumin, and this protein albumin used to be there, and it will come out along with the urine, what we call proteinuria. And it is also characterized by edema due to protein deficiency. Okay, then next is hematuria. This presence of whole blood, pure whole blood in the urine, giving very bright red color, means that is known as hematuria. Intake RBCs will be there, right? When this some hemorrhagic lesions are there, for example, in the urinary system, starting from your kidney, ureters, and all this, maybe in the this thing. So along with this urine, the intake RBCs, the blood may be coming out and it may remain present in the urine. And one of the very common condition means when there is fern toxicity in the bracken fern toxicity, particularly in Himalayan regions, in the foothills of the Himalayan regions and all. So these bracken ferns used to be there, and when accidentally animal used to have or ingest this kind of this bracken fern and all, due to the toxic effect of that bracken fern, so it may cause hematuria. Mostly it used to cause severe hemorrhagic lesions there in the urinary bladder. So blood used to be coming out along with the urine. Okay, and there you may you may see the presence of the intake RBCs. And when you check, the urine sample, okay, by simple, this centrifugation also, or if you leaving it, or you just keep the urine sample in a test tube for some time, then this intake RBC used to settle down at the bottom of the this beaker or the test tube. Okay. Whereas in case of hemoglobinuria, already the lysis of the RBCs used to be there. So that means there is no any intake RBCs. Okay. So in that case, there won't be any settling down of these intake RBCs there, because no intake RBCs are present in that case. So differentiation between this hematuria and the hemoglobinuria, by this simple technique for sedimentation of this intake RBCs, in case of hematuria you will be there, whereas in hemoglobinuria. But grossly, you cannot differentiate it very easily, because both the cases will find bright red color. Okay, because of the one is hemoglobin is there and intake RBC and this RBCs are there, but both will be red in color, blood red in color. So by this simple technique, you can differentiate it. Okay, these are some of the pictures where you may have these lesions of hemorrhagic lesions and this pathological condition presence of the these lesions, or this tumor-like cases or stone and these cases, on these kidney stones and the renal calculi. Okay, concretions. So maybe there, and mostly this presence of this renal calculi in the urinary system, urinary tract and all these things. So it is one of the reasons for causing hemorrhages. Okay, in such cases, always this mostly, if you collect the blood sample, you may get the cases of hematuria. That means intake RBCs used to be present in the urine sample. That means in case of this renal calculi or kidney stone cases, or in case of not only in kidney, in the urinary system, maybe in the ureter, maybe in the urinary bladder, or in the urethra also. So you may come across the cases of urethra and this hematuria. Sorry. So these are some more, and this picture showing hematuria, hemoglobinuria, myoglobinuria. Pyuria means presence of pus in the urine, presence of myoglobin or hemoglobin in the urine, and presence of this intake RBCs in the blood, right? Then hemoglobinuria, as I have already mentioned you, that when there is lysis or depletion of the RBCs leading to release of the hemoglobin portion, so that will come out along with the urine, what we call hemoglobinuria. In this case, the urine becomes brownish red in color. A little bit, this difference as in case of this hematuria, bright red, here little bit brownish or coffee color type little bit. And mostly caused by infections agents like leptospira or babesia, then phosphorus deficiency, and the urine may remain turbid and colored on centrifugation, because there is no any sedimentation of the RBCs here, because there is no any intake RBCs. If you centrifuge also, it will remain same. The color will not change, because intake RBCs are not there to settle down at the bottom, right? Then next is anuria. That means complete absence of urine, means there is no any formation or production of urine, which may be this caused due to absence of urinary secretion due to glomerulonephritis, inelastic renal capsules, which is unable to exert sufficient pressure which is required for the glomerular filtration leading to nephrosis, or it may be due to hydronephrosis, or maybe due to renal calculi, where urine already secreted puts back pressure to prevent the further secretion. Okay, then when there is low blood pressure and when there is dehydration as well as necrotic lesions or changes of the tubular epithelium. Okay, so in all these cases, the formation or production of this urine will not be there. So complete absence of urine, no urination and no production of urine will be there, right? Then polyuria. That means poly means many, increase. When the amount of urination, urine is too much increased, leading to frequent urination, as in case of diabetic patients, means it is very common, right? So frequent urination and more amount also. That is what we call polyuria. Okay, so in many cases like diabetic mellitus, diabetes insipidus, hormone imbalance, polydipsia, then moderate tubular injury, when where the water is not reabsorbed. Okay, means it is going out and there is no reabsorption. So in such cases, in these conditions, the waste products are successfully eliminated. Then next is about uremia, which is very important and very much, these difficulties, you might have heard about this uremia and this toxemia and all these things, right? So what happened is that this uremia is a syndrome, toxemic syndrome, due to toxic materials containing in this urine sample, resulting from the renal insufficiency. There may be presence of the waste products, commonly what we call non-proteinaceous substances, non-protein nitrogenous substances like uric acid, creatinine, and urea in the blood, which are normally excreted through the kidneys. In normal cases, it should be excreted out along with the this urine through the kidneys, but it is retained. It is not going out. It retained and it is going back to the this blood. It is reabsorbed and going back to the blood circulation. Then it is known as uremia, right? And it may be also due to damage in kidneys, or when kidneys are inflamed, or due to this neoplasm, means cancerous growth, when there is abscess, or as well as calculi formations, where the urine used to remain in the system and blocking and the reabsorption of these materials and waste products, non-proteinous nitrogenous substances, NPN. So that used to be going back and reabsorbed to the blood circulation. Okay, going back and reabsorb and going back to the circulation, leading to this condition what we call uremia. And this condition, uremia, used to be mainly characterized by some signs, symptoms like headache, vomition, hyper-irritability, sometimes convulsions, and ulcers in the oral cavity as well as the stomach. There may be normochromic and normocytic anemic condition, anemia, or hemosiderosis, as well as thrombocytopenia. So these are the characteristic features or signs and symptoms or lesions, you can say, and this clinical and this features of this uremia. Then another topic here, this terminology, azotemia. Azotemia, whereas it is the increase of non-protein nitrogenous substances in the blood due to extrarenal factors like dehydration, rapid breakdown of the proteins, and increased metabolism. Okay. Then this uremia may be very more this commonly observed in males than in females in all species of the animals. Justification means why? Means why it is so common in males than the females. This justification you may come across in the exam. Okay, so mostly what happens is that uremia that develops may not be of renal origin at all. This uremic conditions. So this development may not be all the time. They may not be of renal origin, and The reason behind this, I mean, this male and this one is that when the urinary tract is obstructed by calculi, so in this case, I mean, obstruction of the, I mean, this urinary tract, particularly the urethra. Okay. So as you know that in male and female, there is, I mean, these differences in anatomical structures. The urethra used to be very small. The lumen size is very small in case of male, whereas in case of the female, it is broad and it is larger. Okay. So that's why what happened is that there's more chances of this obstruction of this urethra used to be there in case of your, I mean, these males, not in females. And in post-inflammatory strictures, when there is carcinoma of the bladder, prostatic enlargement, and congenital defects, so that may also lead to retention of this urine, which may give back pressure in the kidney, opposing the filtration pressure, so anuria results. Okay, so this way, the male, I mean, this prostate gland is present in this male only, not in females. So this kind of this enlargement, or I mean, when there is strictures or carcinoma, I mean, this of the bladder. So these things may give compression, pressure on the, I mean, this urinary tract and all. This organ, I mean, the prostate gland and all, is not present in female, right? So that may lead to retention or blockage of the urine. So then, if urine is blocked and the urine is not going out through the urethra and all, so it will give back pressure to the kidney, opposing the filtration pressure. Okay, and the urine will get back and it will retain. It will not be coming out. What we call, I mean, urine is not out. The urination is not there. Anuria, right? Then what happened means there will be reabsorption all these and these waste products, uric acid, urea, creatinine, and all these things, right? Then it will go back to the blood circulation, leading to this condition, what we call uremia, right? So that's why it is more common in case of male than the females. That is the justification. Then next is glycosuria, presence of glucose in the urine. Okay, that is known as glycosuria. So it may be found, observed in many. This is when the diabetic mellitus, I mean, cases human and in case of dog or in the animals, of course, then it is not that much common as compared to the human. And it may occur also due to insulin deficiency. Or it may also occur in case of dogs as a result of glycemia. And in case of sheep, due to enterotoxemia caused by one bacterial organism commonly known as Clostridium welsii type D. Right, and next is pyuria. Pyuria means presence of material in the urine. So mostly in case of suppurative inflammatory reaction condition of the urinary tract, means starting from your kidney, ureter, this urinary bladder, urethra, and all. Anywhere in this urinary tract, when there is suppurative inflammatory reaction, that means abscess formation, mostly due to pus-forming organisms, organisms, right? So in that case, there will be automatically pus exudation in that kind of this inflammatory reaction. What kind of inflammation? Suppurative inflammatory reaction. There will be production of pus exudates. So that will be coming out along with the urine. Then it is known as pyuria. Then next is ketonuria, when there is presence of ketone bodies in the urine. Okay. So commonly, this is also found and observed in case of diabetes mellitus patients, then acetonemia or pregnancy toxemia, as well as starvation cases. Okay, then oliguria, that means decreased amount of urine. Okay, it is produced, it is coming out, but less amount. That is known as oliguria. So it may be due to glomerulonephritis, or it may be due to the obstruction of the renal passage, urinary tract, or maybe urethra and all. Then due to dehydration, or then maybe due to low blood pressure, or as in case of tubular damage. So these are the functional disturbances of the urinary system. Okay, so Next is nephrosis. Up to this, nephrosis we'll discuss for today. After that, this is the most important part, that is the inflammation of the this kidney, what we call nephritis, that we'll discuss in the next class. So nephrosis is the degenerative and necrotic changes of the tubular epithelium without producing any inflammatory reaction. When it is getting inflamed, then nephritis. So it is not nephritis, nephrosis. So this is not involving any inflammatory reaction, only some degenerative and necrotic changes of the tubular epithelium, which may include acute tubular necrosis due to ischemia, means less blood supply, or toxic injury to the kidney. So in that case, there may be nephrosis. Okay, and it may be characterized by necrotic and the sloughing of necrosis and the sloughing of the tubular epithelial cells exhibited by uremia, oliguria, as well as anuria. Okay, then the causative agents, etiology, as in case of hypotension, means low blood pressure, heavy metals toxicity, mycotoxins like ochratoxins, then antibiotics, in fact, this administrations like gentamicins or prolonged and this using of this kind of this antibiotic and this gentamicin for long use, for prolonged use. So in such cases, so this condition, what we call nephrosis, when there may be necrosis as well as the sloughing of the tubular epithelial cells of the kidney. Okay, maybe there. Then grossly means you may come across the enlargement, swelling of the kidneys. Okay, as I am showing here. Okay, swelling of the kidneys, and the capsular surfaces may remain smooth, pale in color, as well as translucent. And when you make the section of this kidney showing nephrosis, okay, then stain it and see under the microscope, you will find so many vacuoles empty, not staining in the see here. There are so many vacuoles, empty spaces without any this stain, white, this vacuoles in the tubular epithelium. Okay, when you see the tubular epithelium, white this cell without any this taking and this stains. So these are the vacuoles or vacuolation, formation of vacuoles used to be there in the tubular epithelium. And there may be coagulative necrotic, these lesions of the tubular epithelial cells, coagulative type, some coagulum type of these deposits are there, right? Then sloughing of the tubular epithelium, this damage or this sloughing of the tubular epithelial cells. So that is known as, this is what we call this nephrosis without any involvement of producing inflammatory reaction. If inflammatory reaction, inflammatory cells automatically will be there, and congestion, hemorrhage, and all these things will come up. But there is no such lesions. Only the tubular epithelial cells are swollen up and showing some vacuoles and or some coagulative and this necrotic changes and all, right? No inflammatory reaction. So this condition is known as nephrosis. Of course, the kidney will be enlarged and swollen, right? But it is not due to inflammatory reaction. Okay. So, before starting that, this nephritis, another this, just up to this, hydronephrosis, as we have already discussed, this nephrosis. So another terminology, hydro, means watery, okay, means water content. So in such cases, there has to be, this increased accumulation of the watery fluid, or means maybe in the urinary system, automatically there will be urine. Okay, more amount of this urine. And some other this inflammatory and this, the edematous fluid and this serous fluid also may be there, but mostly man of this watery. Okay, so that will be block. Leading to dilatation of the renal pelvis. You know, the renal cortex, the outer covering of the kidney. Then the innermost layer, the inside this kidney, after the covering of the kidney, what called renal cortex, that is known as renal pelvis. Then from there, from this renal, that is origination starting in the urinary tract. Okay, ureter. Then urinary bladder. then it will go to the ureter and this urethra and all, right? So when there is more accumulation, I mean, when there is any obstruction in the passage of this urinary tract, maybe mostly in the ureter, okay, or like in the urinary bladder or the urethra and all these things. So this kind of this renal pelvis of the kidney used to get much enlarged and dilated due to obstruction of the free flow of this urine through this. It is not going through that because there is obstruction. So there will be retention of more urine in the urinary, this ureter, as well as in the urine and this kidney and this renal pelvis, and sometimes maybe also in the your bladder. Okay, so it may be congenital or acquired. Means it may be due to congenital, I mean by birth, I mean due to some gene defect and all these things. By birth, I mean the animal may have this problem, or sometimes due to some infection and all these things, it may get this problem, like as in case of your renal calculi, formation of kidney, these stones, right? Or it may be unilateral or bilateral, means only one side of the kidney may be affected. So that may be in uncomplicated cases leading to hypertrophy of the other kidney. And when there is bilateral, both sides of the kidneys are affected, automatically there will be death due to uremia. Means uremia, already we have discussed, there is retention of the more amount of this urine which is not going out of the urinary tract to outside. Then retention of this your waste products like your uric acid, uremia, urea or creatinine and all these things will be retained, and it will go back to the circulation, causing your uremia, right? So it is very this fatal when this amount, the level is too high. Okay, so it is fatal, means that it will lead to death of the animal, right? So these cases, hydronephrosis, mainly caused by, I mean, when there is formation of kidney stone, I mean, this renal calculi, and this stone formation, or when there is hemorrhagic cystitis, when there is enlargement of the prostate gland, as in case of dog, then when there is formation of tumors in the renal pelvis and neoplasms, cancerous growths, maybe in the ureter, maybe in the urinary bladder, maybe even in the urethra. And there may be compression of the ureter by the surrounding inflammatory tissues, or due to some cancerous growth neoplasms, or maybe due to this pregnancy cases where the gravid uterus, enlarged uterus is giving pressure, or the ovarian, the ovaries, or the uterine, these masses and all, giving compressor towards the ureter. Then there will be compression of the urinary tract lumen of this ureter. So the free flow of the urine will not be there. So there will be retention of this urine in the renal pelvis, leading to enlargement and the swollen condition of the kidney due to more accumulation of urine. Okay, that what we call hydronephrosis. So in renal calculi, stone cases, so when you go for X-ray and all these things, when the kidneys are showing hydronephrosis, so that may be one of the this indication of your renal calculi. Of course, you can come across and you can observe the presence of the renal calculi also in somewhere in this urinary tract also. And sometimes due to displacement of the urinary bladder in the perineal hernia conditions, okay, cases, that also may cause such kind of this hydronephrosis. So these are some of the these pictures showing hydronephrosis. Okay, this is the renal cortex. Okay, outer this of the kidney, outer portion. Then this is the renal pelvis. See, this is a normal. Then when there is mild this accumulation of the urine, means mild on hydronephrosis, little bit moderate and severe condition. So this renal pelvis used to get enlarged and much dilated due to accumulation of more urine. This is a schematic diagram showing hydronephrosis. Okay, and then down there the ureter. So sometimes the blockage is down there in the ureter, I mean last portion of the ureter, or like maybe in the this urinary bladder and all this thing. The ureter may also accumulate more amount of this urine. Then it is known as hydroureter. if it's in the ureter. Okay, so these are the gross pictures of this hydronephrosis for today, and I'll continue this the urinary system in the next class, and that is mainly about the this nephritis and other this renal calculi and all these things we'll discuss in the next class. Okay.